The rate of blood donation in Nigeria has dropped from over 66,000 to as low as 31,000 between 2015 and 2017. The drop is attributed to the willingness of individuals to donate blood. So these medical practitioners reveal that lives have been lost due to non-availability of blood in hospitals.
We cannot overemphasize the importance of blood and blood products. It keeps us alive. And like the theme for this year's Blood Donor Day, it says, give blood, share life. And also as an orthopedic surgeon, I know that we can't even do without blood. In the maternity wards, you can't do without blood. Everywhere, every serious case, most of the time, you would need blood to address the problems. So, but there is a major deficit in the number of bloods that is donated by those who are not paid to do so. And that's the problem, because the paid donors, they can take any risk to get their blood donated because they will be paid. But the emphasis here is on non-remunerated donors, those who will not ask for money, people who voluntarily go and give their blood. And that number is hopelessly low at the moment, less than 10% of all the blood that is being donated across the country.
The annual blood need of Nigeria is 1.8 million, but we are currently far below this target. And this is why we are collaborating with Trauma Care International Foundation today to create awareness on voluntary, non-remunerated blood donation.
That we recruit as many people as possible to become voluntary blood donors. And when we say voluntary, that is non-paying donors. And at this time, like I said, I'd like to thank the participation of everyone, because giving blood is the highest form of volunteering, and we are indeed saving lives.
To ensure that the tide changes for the better, Dr. Otabo highlighted the advantages of blood transfusion and the common misconception associated with it.
Advantages of blood donation, because there are a lot of myths out there. People think blood donation is tantamount to giving away their lives. No, it's not correct. The more we donate, the healthier we are. And before anybody would donate blood, they must have met some criteria. If your blood is not enough for you to donate, nobody will take blood from you. We always do a test to make sure that you are fit. And some people also have the worries about, maybe at the point of donation, they will be tested for HIV and hepatitis and other things, and they don't want to know. Well, if you don't want to know about your status, nobody will force you to know it because of transfusion. We will still take the blood, but if the blood is not fit for transfusion, we will discard it.
Myths that comes with blood transfusion, and what we are trying to do is to educate the public on the fact that giving blood is safe.
They also clarify the issue surrounding high price of blood at hospitals.
There is still room for more to be done, and we are advocating for the institution of a regulatory body that will not only support and promote voluntary blood donation, but will be able to enforce and even ensure the prosecution of those who have made it their mission to make blood and its product a commodity beyond the reach of those in need for commercial gain.
The National Blood Transfusion Service is, however, optimistic that Nigerians would have a change of heart by donating more blood to save lives. Lilian Ogazi, PTV News.
All right, that's a report on blood donation. I want to thank our correspondent Lilian Ogazi for doing that great work. All right, joining me now is Dr. Christopher Otabo, and he is part of those, or he was part of those that put up that conference. Thank you for finding our time to be here this morning.
Thank you for having me.
Yeah. Now, blood donation, from what our correspondent brought back yesterday, it's obvious that blood donation, as far as Nigeria is concerned, has actually dropped. The rate has actually dropped from over 66,000 to, as less or as low as 31,000 plus. what would you attribute the problems to?
Okay, well, thank you so much for having me, and good morning, viewers. 66,000, as it was 3 years ago, was abysmally low. So that was not even a desired figure. Because if you listen to the Minister of Health during the World Donor Day speech, he says that we need 1.8 million bags of blood every year. And as of 2015, the donation to the National Blood Transfusion Service was 66,000.
Wow.
Majority of that 1.8 million bags will be met. Because if it's not met, that is tantamount to death. But how is that met? It's through the back door. People who position themselves to sell their blood. The laboratory scientists, the hospital laboratories know them. So when there's a call, when there's a need for blood, they call them to come donate, and then they are paid. So that makes blood more expensive, and also because of the character of these people, it becomes a riskier venture for to bleed them and to transfuse blood. So to answer your question, the reason why there has been a low incidence of blood donation, voluntary blood donation, is because of awareness and the myth surrounding blood donation. People are not generally aware that they could be of service to humanity if they donate blood. Some people just hear about blood donation, but it never crosses their mind that they could be the ones saving lives. And if we push it into the consciousness of these people, they will take out time from their busy schedule to go and donate. Yes, for instance, the World Footballer of the Year, Ronaldo, he was asked one time why he doesn't have tattoo like most other footballers. He said because he's a regular blood donor. Because when you have tattoo in your body, nobody will take blood from you. So
why? Why? Let me cut you short. Why?
Yeah, it's just a part of the precaution. Because if you have tattoo, it speaks of many things around your personality. Yeah, and so we don't want to deal with people who appear to be irresponsible, in quotes, you know, when we are taking blood from people. So that's on the one hand. Then two, there's a lot of myths around blood donation. Some people think that when they donate blood, their blood could be used for something. You know, some people think that when they donate blood, they will collapse and die. You know, people think that when they donate blood, the person that receives the blood is taking their destiny. You know, so many myths around blood donation. And then also the issue of compulsory tests for some diseases, because people are afraid that their blood will be tested for HIV, hepatitis, and all that. And they don't want to know. Well, if you don't want to know your status, it still would not stop you from donating. It's a blind procedure. We can take your blood and you go. If it is not suitable for donation, for transfusion, we discard it. If it's suitable, we donate. We give it, and you have the right not to know your HIV status.
Okay, now let's look at some other factors. Donate blood, save a life. Now there are some school of thoughts that believe that even if they go out there to donate blood for free, the hospital end up, selling those blood. That why should I donate blood for free? And the hospital will now sell it. And they don't just sell it, at quote unquote affordable price. They might end up selling it at a very exorbitant price.
Oh, thank you very much. Thank you so much for that. And that's one reason why people are discouraged from donating blood. I cannot just take your blood and put, into another patient. There are costs involved. Even though the blood is coming free from the donors, even from the National Blood Transfusion Service, the government agency who does not have any business making profit from blood donation, they will still charge anyone you can donate blood now, and as you are crossing the road, God forbid something happens, and you are taken to the hospital, and you need blood. That your blood that was donated cannot come to you for free.
For free, wow.
The reason is because we have to do a test on the blood. The hospital will do blood group to check which group has been donated and which group is the person that is going to receive the blood. That is cost. Blood group test in many places 1,000 naira plus for just to do blood group for the recipient and the donor. That's already almost 3,000 naira. Then you have to do HIV test, the ELISA. You have to do hepatitis. You have to do hepatitis A, B, and C. You have to do tests for syphilis, venereal disease. All those tests for 1 pint of blood would not be less than 5,000 naira at the minimum. But many times in many centers it's going close to 10,000 naira. Then the blood itself, you don't carry it with your hands. You put it in a blood bag. The blood bag costs money. Then many times you have to save the blood in the refrigerator. You need money to power the generator that will keep the blood at the optimum temperature. So all those are costs factored into it. So for the National Blood Transfusion Service, for instance, to get a pint of blood out there, it's about 5,000 naira. That's all. You are not paying for the blood. You are paying for the services that will make the blood suitable to be transfused. But if you go to other hospitals where you have paid donors or laboratory, maybe for a pint of blood, the donor is paid 5,000 naira or 8,000 as the case may be, depending on the blood group. If you factor that into it, at the end of the day, you might be getting blood for close to 20,000 naira in some other hospitals where you have paid donors. So the difference is quite significant. 5,000 naira from blood transfusion service and close to 20,000 naira from the paid donor source. You can see the reason why cost is applied to the blood, even though it is taken for free. It's gotten for free, but there are so many things involved in making the blood suitable for transfusion.
Yeah, but some school of thought will also not want to totally agree, with this position. Not because the position is wrong, not because the position is lacking merit, but some will also say that, okay, if you're calling on me to come and donate blood for free, why don't you make all of these tests in your own capacity to also be free, so that the next man that we are claiming to save his or her life can also get the blood at a very, very minimized rate, rather than, for some people, 5,000 is even very high. So what do you think the government or the Ministry of Health can do, or even the hospital, running all these tests? You have all of the facilities, you have all of the chemicals, and if 10 people come out to donate blood for free because they want to save a life, and you need to carry out some of those tests, can those tests be carried out for free, so that more people can also come and say, okay, fine, since my blood is given out for free, I am willing to donate over and again?
Well, that's the ideal. It's where we ought to be going to. But in the phase of dwindling government resources, where there's no money to go around, the government is fighting insurgency, the government will have to take care of education, the government will have to do so many things. Yes, health is very, very important, and this is where we should be going. But at the moment, that is not the reality we have, because I've interacted with the National Blood Transfusion Service. Just the same way budget is affecting everywhere, that's the same way budget release is also affecting them. And we cannot wait for that utopian time when government will be able to provide all the testing reagents, all the blood bank and everything for free, for us to be able, for us to be able to get the blood, to the recipient for free, completely free. That's desirable when there's enough fund in the ministry or in the blood transfusion service. That's okay. And we also seek partnership with non-governmental bodies. If not, NGOs can bring in the blood bags, bring in the reagents, bring in the coolers and everything. At the end of the day, it will get to the common man for free. But for now, what we are trying to do is to create awareness for more people to be able to donate. Because if you still go to donate, you are still helping the public. You are still helping save life. Because it's easier to get 5,000 naira to get a blood bag from the blood transfusion service than to be looking for 20,000 naira to buy blood. So there's still a major dent in the amount of money that will be required. If people would not go voluntarily to donate, eventually people will have to buy blood at the rate of as high as 20,000 naira. So you can see that service is still being rendered. Something is still being done. But the ultimate is universal health coverage, where blood would be given for free. And we hope that we will get there someday.
Now, let me take you a little bit out of the scope and then take you a bit further. I know that sometimes we see the NMA, the doctors come out to tell the federal government that they are embarking on strike and all of that. And most times, their agenda are almost or always self-centered. Either good remuneration, good working condition and all of that. Now, if blood donation and all of these tests that you've outlined is anything to go by, do you think the medical practitioners should also add some of these major problems, to their agitation in case there is any time soon that they want to go out to embark on any strike? Because life is worth living, and like the theme of your meeting yesterday, donate the blood and save a life or thereabout, I think is worth emulating. So do you think the NMA should take a step further by including this in their next agenda, that okay, every blood that is donated free can also be transfused free of charge, as far as you are in Nigeria? Are we going to get to that level?
Well, blood donation or availability of blood is just a fragment of the plethora of problems that is bedeviling the health system. And you can't just single out blood donation and say you want to go on strike because of...
no, you add it up.
Yes,
you add it up.
What is added is increased funding to the health sector. If the health sector is funded well, nobody will talk about cost of blood. So, and based on the resolution of the African Heads of State Summit that held in Abuja in 2002 or thereabout, it was stated clearly, and all the heads of government agreed that 15% of our national budget should be spent on health. But in the since that time to date, there's no government that has done even 10%. We were hovering around 5% to 6%. So if more funding is given to the health sector, things like this will be taken care of. And this is what the NMA has been fighting for. Increased funding to the health sector. And many other things, including the welfare of doctors. If the doctors fight for their welfare, it's in the interest of the public. I mean, just imagine getting a pilot who is hungry and you put him in the sky, he's angry. He's going to crash the plane. So if your doctor is not happy and not satisfied, you are not going to get anything good out of his input into your healthcare. So it's not out of place for doctors to agitate for better condition of service. The alternative is to go out. And there are thousands of Nigerian young doctors who are going out every year to get employment outside, UK, US, and all that. And it's depleting our system. So we have to look at the problem holistically and brace up to tackle them rather than just looking at it from one small angle.
Now, I know you've had interactions with the Minister of Health. Will you say you're satisfied with the way he's been carrying out the activities of the health ministry?
Well, within the limits of the resources that he has, I think that he's doing well. Yeah, is doing well. I can say give
Okay.
him a pass mark.
All right. Back to blood donation and all of that. Who is, I'm trying to use the correct word now, who is healthy enough or who is ripe enough to donate blood? Are
Okay.
there age limits? Are there criteria I need to look out for before I go out there to donate blood?
Yes, there are limits. Well, anybody that's 65 years and above would not be expected to donate blood because of they are elderly. And then less than 18 will also not donate. But then women who maybe just gave birth or within just or during their menstruation they cannot donate. Then there are also other criteria, laboratory criteria, like your PCV, your blood volume, your blood level. A PCV of less than 36% for women will not be expected to donate, and about 40% for men. So you have to have enough volume so that it doesn't disturb your hemodynamic balance. Then, of course, if there are other diseases, you cannot donate. But apart from that, most other people can donate. But please, let me just take a minute to talk about the program we held yesterday.
Okay.
On the 30th of June is the day that we are mobilizing the entire Nigerian population to come and register between the hours of 9 a.m. to 5 p.m. Within that 8-hour period, we want to mobilize 10,000 Nigerians to come and register for donation. Many of them can donate that same day, but after that registration, they have from that day till 26th of July to do their donation. So we want to introduce 10,000 people into the blood donation habit, and hopefully we'll be able to maintain most of them to keep donating subsequently. It's going to meet a very important need in the society. So 30th of June is a Saturday. That's the day that we want to use for the registration. And then within 28 days from that day, they must donate their first pint. And hopefully, we'll also continue to contact them from the data they provided so that we'll keep getting them to come donate. And in case of emergencies, the hospitals, we can share those people's data with hospitals. So they can call them to come and donate, and they willingly do that.
All right, Dr. Christopher, before I let you go, my final question. For men, it has to be 40, and for women, 36, or less than 36 will not be allowed to donate blood. For men, you have to be 40. Your PVC has to read, PCV has to read from 40 and above. Now, after donation, what should the individual be doing to regain back his health?
There's nothing lost after donation. It's just after taking 1 pint of blood, which is 450 ml of blood, it's just to rest, drink water to replace the volume, or take a soft drink, and then you get up and go away. The body has a way, an inbuilt mechanism of quickly replacing that blood within a couple of weeks, maybe 1 month, 2 months. The blood level has come back to normal. Yeah, so there's no worry at all. All you just need to do is take water or soft drink just to replace what has been lost. We've done this over and over again, and if it was not so, nobody would come to the public space to tell you what is dangerous to your health. Yes.
Wow.
And this blood donation drive is being championed by Trauma Care International, Trauma Care Foundation International, in association with the National Blood Transfusion Service. So you can check Trauma Care International Foundation on the web, and you can just read more about what we are doing.
All right, Dr. Christopher Otabo, thank you very much for finding our time to be here.
Thank you.
We know you're a very busy man. We have to allow you go so that you continue doing the good work you're doing out there. All right, I've been speaking with Dr. Christopher Otabo about donation of blood. And right after now, I'll also try and donate. I don't have a tattoo, so I can donate. All right, thank you very much for finding our time to be here. All right, we'll take a short break, and when we come back, more discussion will continue on New Day on PTV.